My name is Samantha Harris-Fox. I work as a lecturer in nursing at the University of Derby, and I'm going to give you a bit of an introduction to ECMO. The learning outcomes for this session are to understand ECMO support, to explore the role of ECMO in supporting patients with COVID-19, and to recognise the nursing priorities when caring for patients receiving ECMO. So what is ECMO? ECMO stands for extracorporeal membrane oxygenation. More simply put, this means oxygenating the patient's blood from outside of the body using a membrane oxygenator. This uses technology which was originally developed for supporting patients undergoing cardiac surgery, such as coronary artery bypass grafts or even heart transplants. But it's been adapted and modified for prolonged use to provide advanced life support in intensive care settings for patients with a range of conditions which may have caused severe respiratory, cardiac or cardiorespiratory failure. There are two primary types of ECMO, veno-venous and veno-arterial. Veno-venous provides respiratory support only, and veno-arterial provides both cardiac support in the heart and respiratory support. For the purposes of this session, we are just focusing on veno-venous or VV ECMO, as this would be the main type of ECMO support used to treat patients in severe respiratory failure and potentially those with COVID-19. ECMO is only available in designated intensive care units in the UK. This is due to the clinical expertise that is required in order for ECMO treatment to be successful and have a positive outcome. So how does ECMO work? Firstly, to provide VV ECMO, in most cases a double lumen cannula would be inserted into the right internal jugular vein. This allows the patient's blood to be circulated out of the body by a pump. This is represented as a circle in that diagram. This pump pushes the blood through an oxygenator. In this oxygenator, the patient's blood will pick up oxygen. Carbon dioxide will be removed from the patient's blood, and the blood will also be rewarmed before being pumped back into the patient via that double lumen cannula in the right internal jugular vein. In some cases, ECMO may be facilitated by using a single lumen cannula in the right internal jugular vein and another single lumen cannula in one of the femoral veins, but the concept of how this works remains the same. So how could ECMO help patients with COVID-19? Well, some patients with COVID-19 will develop severe respiratory failure and be transferred to our intensive care units for ventilation. However, in severe cases, the patient's lungs may be so affected that they cannot oxygenate or remove carbon dioxide even when receiving mechanical ventilation. There is some evidence to show that turning the patient into a prone position may be effective in patients with COVID-19, but there still may be some patients that continue to deteriorate despite ventilation, despite prone positioning, and may require ECMO. ECMO can be considered because it basically allows the patient's lungs to rest without being subjected to the high concentrations of oxygen or high ventilation pressures, which can cause further damage to the lungs and exacerbate the underlying cause. Ultimately, ECMO can completely take over the function of the lungs during the patient's illness. It can only be offered to patients with potentially reversible conditions, though. There is a good evidence base to support the use of ECMO with COVID-19, as in the H1N1 flu epidemic in 2019, ECMO was used with success in many of the designated ITUs providing ECMO throughout the country. So considerations. Unfortunately, not all patients will be suitable for ECMO. As I said previously, the condition must be reversible, as ECMO does not actually treat an underlying condition. It simply provides that advanced form of support whilst other treatments, manoeuvres, etc. are put into place to treat the underlying cause. So the patient must have previously been fairly fit and well. Their range of comorbidities will be looked at to consider if they are a suitable candidate for ECMO. Another consideration is the period of ventilation that they have received prior to being referred for ECMO. If a patient has been ventilated for greater than 5 days on high pressure or high amounts of oxygen, it may be that the lungs are already too damaged for ECMO to be of any use. There also needs to be no contraindication to limited anticoagulation. And ultimately, the team at the ECMO centre will consider all the aspects to do with the patient, very objectively look at their previous medical history, the care that they've received whilst ill with COVID-19, and really consider whether the patient will benefit and whether they'll be able to return to either their previous level of functioning or a level of functioning that is appropriate for that patient. There is limited ECMO beds, just like intensive care in general. So obviously there needs to be a bed available at an ECMO centre in order for that patient to receive the treatment. The critical care transport is also a consideration. These patients are extremely unwell and in some cases may be too critically ill to safely move. In that situation, mobile ECMO may be an option where the team from the ECMO centre will come to your hospital, they will cannulate the patient onto VV ECMO whilst in your hospital, and then they can transfer them safely back to the ECMO centre. The main aspect of your nursing role in this time would be helping to prepare the patient for transport, helping them to be prepared for the procedure, such as arranging theatres and equipment and the necessary personnel required to help assist with the cannulation. So what does the nursing care of a patient receiving ECMO look like? Firstly, it's more often than not a 2-to-1 ratio. So there would be an ECMO specialist nurse and an intensive care nurse looking after that one patient. The ECMO specialist nurse will be a very experienced ITU nurse, but somebody who has received additional training involving ECMO to give them the knowledge and skills to maintain and manage ECMO technology, including anticipating complications and management of emergency situations which may be related to the malfunction of ECMO equipment. That being said, the ECMO team as a whole is very, very important. We know that successful ECMO care happens when a team approach is adopted. So every healthcare worker has a role within the care of that ECMO patient. This includes physiotherapists, dietitians, radiographers, healthcare assistants, all members of that multidisciplinary team. The intensive care nurse's role doesn't differ greatly to that of looking after any intensive care patient. Monitoring each body system for any clinical changes, meeting patients' hygiene needs, providing pressure area care, consideration of nutritional requirements, administering medications. However, all of these tasks must be taken under the supervision of the ECMO specialist. That's because anything you do to an ECMO patient can cause either hemodynamic complications in that patient or actually complications due to the ECMO equipment itself. So the ECMO specialist nurse must be there, observing, involved in that care, so that any changes to the patient's condition, whether they result from a hemodynamic cause or the ECMO circuit themselves, can be rectified as soon as possible to maintain that patient's safety. The care of the family and the carers is a big part of the role. The family of any patient in intensive care needs a lot of support, but with COVID-19, patients and families are in a very, very different position. They may not even be able to see their relative. So it's very important that we continue our support, whether it be remotely, via FaceTime, Skype, telephone. Other aspects of the nursing care which need to be considered are related to, firstly, sedation. Patients may be fully sedated, as in other intensive care patients, to facilitate complete lung rest. But equally, some patients may be nursed awake on ECMO, which brings with it a lot of implications for your role of a nurse. If patients are nursed awake on ECMO, it has many advantages with regards to lung recruitment, helping them to effectively cough and clear secretions. However, there are many safety considerations. The main thing being the priority to the patient's safety and ensuring that the ECMO cannulas and other invasive lines are not dislodged. Also, if a patient is awake, breathing for themselves, coughing, that could cause some problems with the actual ECMO technology. So again, very important that the nurse and the ECMO specialist work closely together to support the patient and maintain the safety of the ECMO equipment whilst they are nursed awake. The psychological care of the patient is particularly important as well as the physical in this case. Apart from the fact the patient may be disorientated due to different medications, due to hypoxia, they're also going to be terribly scared of being in this environment. So, cannot emphasize enough how important the psychological care is, and that this should not be forgotten in your role of caring with these patients awake on ECMO. Your role in the respiratory management is equally important, working in combination with the physiotherapist. Although during ECMO the lungs are not the main source for gas exchange and the ventilation settings will in fact be very low, the other things that we can do to help with lung recruitment, to clear endotracheal secretions, are so important. Especially with COVID-19, where we know the way that the condition presents can result in pneumonias and a lot of secretion production, which can be very, very difficult to clear. Again, anything you're going to do that may involve moving the patient, repositioning to help with lung recruitment, actively endotracheal suction in the patient, should be done under the supervision of the ECMO specialist. Again, so they can observe for both hemodynamic changes and any complications in the ECMO technology resulting from the manoeuvres that you may be doing. Anticoagulation is also a big consideration. Patients will usually be anticoagulated with heparin to prevent both thromboembolic complications from the blood being pumped through the ECMO circuit, and also to prevent clot formation in the oxygenator, which can be an emergency life situation should the ECMO oxygenator stop working. So patients therefore are at high risk of bleeding, either internally, i.e. a cerebral bleed, or due to the invasive lines that may be in situ. And there's a fine balance between maintaining those optimum levels of anticoagulation and management of any bleeding complications that should arise. So as nurses performing care, we must be very careful in performing that care. For example, causing damage to the mucosa in the mouth when you perform mouth care can result in bleeding, which can be very difficult to stop. If patients are having new lines inserted, such as new central line, chest drains, again, all measures need to be put into place, which may involve reducing the amount of anticoagulation to try and prevent the active bleeding from occurring. Other things we may do that could cause bleeding might be inserting NG tubes, urethral catheters. All need to be considered carefully before we do that. Patient safety is optimum, and it's always going to be preferable to avoid bleeding from occurring than to try to stop active bleeding. So the key messages are patient safety. As with any intensive care patient, patient safety is paramount, but even more so in maintaining those ECMO cannulas and maintaining the performance of the ECMO circuit whilst the patient needs that critical care life support. Anticipation of complications that might arise through our nursing care and might affect either the patient's hemodynamic stability or the function of the ECMO circuit again. And that multidisciplinary team approach is absolute paramount. But the message I'd like to leave you with is that nursing interventions should only be undertaken with supervision of the ECMO specialist nurse or appropriate medical personnel. On the next slide, there is some suggested further reading should you want to find out a bit more about ECMO and a bit more about the nursing care of patients receiving ECMO. Thank you very much.